Okay, then let's start with the next topic. I'm sorry, that's not the diaphragm, that is the vessels of the thoracic wall. You have to, I'll go through the intercostal arteries, intercostal veins, and then we will go through the nerves, intercostal nerves. Okay, let's start with the vessels of the thoracic wall. The major vessels of the thoracic wall, these are the ones that run in the intercostal space. These will be the, if you take any intercostal space, any typical intercostal space, you will see the artery that is running from the entering from the posterior aspect, that is called posterior intercostal artery. That is the artery that is entering from the posterior aspect. These are usually the branches of aorta. I will go to the detail. These are the posterior intercostal arteries, and then that are from the anterior aspect, these are the anterior intercostal arteries, and these are the anterior intercostal arteries. And okay, now, the question that is usually asked is regarding their branches, their branches, and their origin. Let's do the origin and their root and branches first, then we will go into the detail of the branches. Let's follow the artery. This artery, in most of the cases, arises from the posterior intercostal artery, arises from the aorta. It enters the intercostal space and it starts to run between the two layers of muscles, the innermost intercostal and inner intercostal. It runs there, and as it goes forward, it gives rise to this branch. This branch you may be able to appreciate. This is called collateral branch. The upper branch, the main course, it runs at the lower margin of the rib above in the subcostal groove. However, the collateral branch, it runs down and it runs along the upper margin of the rib below. So these two, main branch and collateral branch, they run across it. They will give branches to the muscle. These will be unnamed muscular branches. They will give branch to the pleura inside. These will be pleural branches. And the one main branch that will go outside is this one. This is the lateral cutaneous branch. It will pass through the internal, external, serratus anterior, and it will go all the way to the subcutaneous tissue, and it will run anteriorly and posteriorly through its branches in the lateral in the subcutaneous tissue supplying that area. This is the lateral cutaneous branch. You must have already studied this branch when you studied about the gross anatomy of breast, that from the lateral aspect it is supplied by this lateral cutaneous branches of posterior intercostal arteries. Anteriorly, mostly there are branches from internal thoracic artery. They may arise separately. There are two anterior intercostal arteries. There are double, superior, upper and lower, and they may arise from a single part and divide into upper and lower, or they may originate separately from the artery. The upper one will go to anastomose with the main uh, posterior intercostal artery, and the lower one will go on to anastomose the collateral branch of posterior intercostal artery. So this is the main artery. Now let's see from where does all of these branches come from. Let's start with the posterior one first. Posterior one, these are the posterior intercostal arteries. There is one tricky item that sometimes we forget to mention, that the posterior intercostal arteries, they arise from the third onwards, they arise from aorta. Posterior intercostal arteries, they arise from third one, they arise from aorta, and below T, third onwards, all of these arise from aorta. So I'm looking at the chest from the right side. This is the third intercostal artery. Now this is the third intercostal artery. This will be the fourth intercostal artery right here, and you will go on to 5, 6, 7, 8, 9, 10, 11. I told you there are only 11 intercostal spaces. So the last one, this is the 11th intercostal artery. The last one that runs below the 12th rib, this one, this is not 12th intercostal artery. Its name is separate. It is called subcostal artery. So in talked about the artery that is starting from 3 all the way to 2. So the third, these are from the intercostal arteries. These are from the aorta. As the aorta in the midline, you can see aorta is on the left of the midline. So the left intercostal arteries will be rather smaller as compared to the right intercostal arteries, because they have to cross the midline to reach their intercostal space. Now, what about the first two spaces that we had left? So these are the first two spaces. These. This is the first intercostal artery. This is the second intercostal artery. As you can very well see, these two intercostal arteries are not originating from the aorta. So where they are originating from, you can follow them. These two arteries are coming from a common artery. This is the first one. This is the second one. These are coming from a common artery, and that common artery is called superior intercostal arteries. Maybe in some book you may read the supreme intercostal artery, but keep things simple. Superior intercostal artery. Where is the superior intercostal coming from? Superior intercostal artery is coming from another artery that is called costo-cervical trunk, because this is an artery. This is a branch of subclavian artery. This is a branch of subclavian artery that gives supply to the first two ribs, costo, and its other branch goes to supply the neck. So its name is costo-cervical artery. So if you are asked to trace back the first intercostal artery or second intercostal artery arises from superior intercostal artery. Superior intercostal artery in turn arises from costocervical trunk. Costocervical trunk in turn arises from subclavian artery that is coming from brachiocephalic artery. So on the right and the arch of aorta from the left. So at least if you don't, if you forget the costocervical trunk, you must remember superior intercostal artery coming from the subclavian artery. So these are the posterior intercostal arteries. You are going to find this picture mostly. This is a picture from Gray's Atlas. You will find the similar pictures in your Netter's Atlas also. So they have shown the similar thing right here. This is the third one, and this is the costocervical trunk, superior intercostal or supreme intercostal artery giving rise to first and second intercostal arteries. Now, anterior intercostal arteries. Anterior intercostal arteries, going back to the model, I will show you back here. The anterior intercostal arteries are being supplied from this. This is called internal thoracic artery. Internal thoracic artery is an artery that arises from subclavian artery. As you can see from the top, it is arising from the subclavian artery. It runs down, it runs on the lateral aspect of the sternum, and it runs down in the lateral aspect of the sternum, and at the it goes on to supply six intercostal spaces. So you can see I will discuss their other branches onwards. It will supply here the first intercostal artery, anterior intercostal artery, the second, the third, the fourth, the fifth, the sixth. What happens after the sixth? Here is that point. Here is that point. What happens after the sixth? This artery bifurcates. This artery, this was the internal intercostal artery. This artery bifurcates into two branches. The part that goes in the same line to the anterior abdominal wall, this one, this is called superior epigastric artery. You remember below the xiphoid process there was epigastric space, epigastric fossa. So this is superior epigastric artery that will go into the abdominal wall, and that one is the musculophrenic artery that will run near the diaphragmatic gutter, or the point where diaphragm is attached to the uh, ribs. So the anterior intercostal artery number 1 to 6, these are coming from the 1 to 6, these are coming from the internal intercostal arteries. 7, 8 and 9, these intercostal arteries will come from musculocutaneous artery. There will be no 10th and 11th anterior intercostal arteries. Why? Because 10th and 11th spaces are open. There is the 10th rib and there is the 11th rib, and in between them there is a 10th intercostal space, and there is no costal margin here, so there is no need for anterior intercostal arteries. So there will be intercostal arteries till number 9. 1 to 6 will be from anterior and internal intercostal arteries. The next three will be from the musculocutaneous artery. They are shown here in the picture. As you can see them here, internal intercostal artery coming from subclavian artery, the first one, the second one, third one, fourth, fifth, sixth. Here is the superior epigastric artery going to abdomen. Here is the musculophrenic artery that gives rise to 7th, 8th, and then last one will be the 9th one. And there will be no 10th and 11th. So there is the anterior intercostal arteries. So by now you must have memorized the arteries arising from the origin of the anterior and posterior intercostal arteries. The anterior intercostal arteries, first six from internal thoracic, the next three from the musculophrenic. There are no 10 and 11, and there is no anterior 12 one also. Posterior intercostal artery, first two are coming from superior intercostal, that is in turn coming from subclavian. The next ones are coming from the aorta all the way till 11th intercostal and subcostal. And again, keep in mind that you will be you have to remember that uh, there is no 12th intercostal arteries. I want to show you another picture. Let me get to that. I think I have that picture. Give me a second. Give me a second. You asked a question regarding coarctation of aorta. What is coarctation of aorta and how does these connections come into play? That's what I wanted to discuss with you. So let me get to a picture that is helpful. Then we will share that. Sorry, a second. I just wanted to show you the collateral circulation in the case of coarctation of aorta or notch strips. Yes, I found a picture. Just let me set it up for you. Okay, so this is it. So coarctation of aorta. So what happens in coarctation of aorta? Sometimes due to any congenital defects, the aorta may be very narrowed and aorta may be closed beyond a particular point. So aorta may be narrow and closed at a particular point. That is called coarctation of aorta. It is narrowed down. So the issue is that if the aorta is closed from that point onwards, you can get arterial supply to the upper limb, to the head and neck, to the upper limb, but beyond that the blood supply is not possible. So logically speaking, the person does not have any blood supply to the lower wall, so the person may develop ischemia of the upper lower limb and so on. So how does that person survive? So there is an alternate pathway. I am discussing you only one of the many alternate pathways. There are other ones also. This connections between the internal anterior and posterior intercostal arteries. So you can see subclavian artery is, in the case of coarctation of aorta, the subclavian arteries are totally intact. There is no effect on the subclavian arteries. So the arterial supply is going very finely to the upper end limb and head and neck. as you just remember that subclavian artery give branch to the internal thoracic artery. Internal thoracic artery give branches to all of the anterior intercostal arteries. So this becomes a source of flow. So the blood flows from the arch of aorta to subclavian artery, internal intercostal artery. From internal intercostal artery it goes to the anterior intercostal. From anterior intercostal it goes to posterior intercostal and aorta. And that's how the blood reaches the aorta through all of the intercostal arteries. So that is the major way in which the blood flow to the aorta is maintained. So from the intercostal arteries to the superior from the so that's how the flow is maintained. So these are the intercostal. This is the collateral circulation that maintains the sorry. So that's the alternate circulation that helps from the arch of aorta to the subclavian arteries to internal thoracic artery to anterior intercostal artery, posterior intercostal artery to thoracic aorta, and then to the thoracic aorta. It can be distributed all the way in the different regions of the body and the abdomen and lower limb. So what happens is that as the blood flow is maintained to the anterior and posterior intercostal arteries, they swell up. They become large in diameter. As they swell up, whenever there is a large blood flow, the arteries they become tortuous. They don't remain straight as that. They become tortuous, and they may even make small notches in the rib. And when you see the X-ray of a person, you will see small notches in the rib. So this is the reason behind in the case. So this is coarctation of aorta and alternate blood flow. Then it comes to internal thoracic artery. Internal thoracic artery, we have just discussed most of its branches. We have discussed internal thoracic artery that it arises from the subclavian artery. We discussed that it runs in near the midline, near the sternum, and gives supply to the gives origin to the first six intercostal spaces. Then it divides into the these two arteries, superior epigastric and musculophrenic. And then you are sometimes asked a question regarding the branches of the subclavian artery. Whenever you are given a question regarding any artery, you must remember the following headings. Tell where it starts. It originates from subclavian artery. Tell where it ends. It ends at the bifurcation or into superior epigastric and musculophrenic, and then tell its branches. So let me show you those these branches. You must give prepare them from a questions from a theory perspective. You get the root, and let me get the branches. So what are its branches? Let me isolate it, make this picture less cluttery for you. So here it is. So this is the internal intercostal artery, internal thoracic artery. It started from the subclavian artery. As it comes down, the branches that you have already studied, these one, the going to the side, these are the intercostal arteries, anterior intercostal arteries. Then there are branches that are coming in the anterior direction. If you look from the side, these are the branches that are coming in the anterior direction that we studied in the skin segment, and the skin part that are going to supply the cutaneous areas. These are the anterior, these are the perforating branches. They perforate through all the layers, through the inner and external inner intercostal muscle, external intercostal muscle, and they come all the way to the subcutaneous tissue. And then these two branches, anterior intercostal branches, perforating branches, the two terminal branches that you already know, superior epigastric and musculophrenic branches. And that leaves us with two branches that you won't study as much in the thoracic wall, but most in the thoracic cavity. One, as you can guess already by the beating, this is the artery that is called this is called phren artery, pericardiophrenik artery. It arises from the uppermost part of the internal thoracic artery. It runs on each side of the pericardium, on each side of the heart. It supplies the pericardium, and it goes on to supply the give branches to the diaphragm also. And then there are branches that are going on the interior aspect that are going to supply the different parts of the mediastinum. These are the these are the mediastinal branches that are going to supply the structures of the mediastinum in the superior and anterior mediastinum, maybe the thymic gland they supplies. So these are the branches that you must know: the anterior branch, the anterior intercostal arteries, the perforating arteries that are going to supply the skin, the pericardiophrenik artery, mediastinal arteries, superior epigastric artery, musculophrenic arteries. So this is all about the arteries of the thoracic wall. Veins, I will not go into that much detail as we mentioned in the arteries. Within the intercostal space, their behavior is the same. They will run in the intercostal space, they will run in the main coart vein, will run below in the subcostal groove near the lower margin of the rib in the upper part of the space, and they will have the same tributaries as they were branches of the arteries. They will have collateral, they will have lateral cutaneous, they will have anterior perforating and muscular and pleural branches and all that. The question that is tricky, that sometimes students forget to prepare, and that's not very much discussed in detail in Snell's clinical anatomy, that is where do all these veins drain. Let's talk about the anterior intercostal veins. The anterior intercostal vein, it is very easy. Just follow the pattern of the anterior intercostal arteries. The first six anterior intercostal veins, they will drain into the internal thoracic vein, also known as internal memory vein. The next three intercostal veins will drain into the musculophrenic vein, just as the anterior intercostal arteries, and there will be no anterior intercostal veins for the space 10 and space 11. So you're done with that. Now the tricky part is the posterior aspect. Posterior aspect, you must understand a difference between the arterial and venous system. That on posterior aspect you had thoracic aorta that was running throughout the length of the thorax. In posterior aspect of the thorax, you do not have a vena cava that runs throughout the whole length of the thorax. Superior vena cava ends right here as it enters the thorax. Vena cava ends right here as it enters the heart. So between this and this, there is no vena cava, so there is no corresponding image of the veins as there was for the arteries. So here two veins run. The vein that runs on the medial aspect, the right aspect, that is called azygous vein. That is a large vein that goes all the way and it enters into the superior vena cava. That is azygous vein. I will discuss how it is formed and which veins does it drain. On the left side, there is hemiazygous veins. This is hemiazygous vein below, and above there is accessory hemiazygous vein, and they both drain into the azygous vein. So let's follow them one by one. Let's follow from the right side. The right side azygous vein, how it is formed. It is formed by the union of three arteries, three veins from the lumbar abdominal region. So the 12th one, or the subcostal art vein, and then there is a zygous vein counterpart running in the abdomen, the lumbar vein, that is called ascending lumbar vein. And then there is a vein, that connects it with the vena cava. So there is lumbar azygous vein, there is subcostal vein, and this is lumbar azygous vein, there is subcostal vein, and there is ascending lumbar vein. These 3 points join, and they join and they go up as the azygous vein. Azygous vein will move all the way up on the right side, right of the midline, and at the level of T4 and T5 disc, at the level of angle of fluid, it will enter the superior vena cava. So let's see which veins drain into it. I will go from above downwards. First intercostal vein, first posterior intercostal vein. First posterior intercostal vein drains directly into the brachiocephalic vein. It drains directly into the brachiocephalic vein. First intercostal vein. Then comes the intercostal vein number 2, 3 and 4. These three, they join together to form a common vein. This common vein is called right superior intercostal vein. And that right superior intercostal vein, it drains into the azygous vein. Then 5 onwards, everything 5, 6, 7, 8, 9, 10, 11 subcostal, all of these drain into the azygous vein. So ultimately all the veins except the first posterior intercostal veins are draining into the azygous vein. I'll repeat, the first one will go directly into the brachiocephalic, 2, 3, 4 will drain into superior intercostal, and from there they will go into the azygous. 5, 6, 7, 8, 9, 10, 11 subcostal, they will go into the azygous vein. From the left aspect, from the left side, it is some different and similar at the same time. Similar in the way that first will go directly into the varicose vein. Similar in the aspect that 2, 3, 4 will form similar superior intercostal vein as the superior intercostal vein will form here, but different in a way that this superior intercostal vein does not drain into the superior azygous vein or accessory hemizygous vein. It directly goes into the brachiocephalic vein. So that's the difference. That's the key difference. The 2, 3, 4 are going to drain into the brachiocephalic vein. Then comes the 5, 6, 7, 8. 5, 6, 7, 8. The next 4 they drain into the upper one, accessory azygous vein, hemiazygous. Then 9, 10, 11 subcostal. The lower 4 they will go into the hemiazygous vein. And the accessory hemizygous and hemiazygous themselves, they both cross the midline and they drain into the azygous vein. And sometimes you're asked question regarding where they do cross the midline. They usually cross the midline at the level of thoracic vertebra number 7 and 8. And here they cross the vertebra. This is the 1, 2, 3, 4, 5, 6 at 7 accessory hemiazygous and 8th hemiazygous vein. It crosses the midline to drain into the azygous vein. So that's how the veins drain there, and that is the very good picture. I like this picture from BD Churasia. That gives you a very comprehensive account in the pictorial form regarding where do the posterior intercostal veins drain. And these are the pictures from Gray's Atlas, and anteriorly you just follow the arteries. Lymphatics from anterior aspect, it's very simple. From the anterior aspect of the nodes, from the anterior aspect of the spaces, they will go the nodes that are present along the internal thoracic arteries. These are called internal thoracic, yeah, internal memory nodes, or also known as parasternal nodes. These are all the names from the same vessel: internal thoracic, internal memory, parasternal nodes. And from the posterior aspect they go into these nodes. These are called posterior intercostal nodes, and they will drain from the posterior aspect. You must be able to follow these lymphatics all the way to the venous drainage. I'll just go through it briefly here. We'll go into the detail as we'll move into the by the end of the thorax. These internal and thoracic veins, they go up and they will form their parasternal loads. They will form parasternal lymph vessel, and this will drain into the brachiocephalic vessel, and this will bronchomediastinal trunk, and bronchomediastinal trunk on the right side will go to the right lymphatic duct. On the left side it will go into the uh, thoracic duct. And the posterior aspect, it will go into the bronchomediastinal trunk, and on the left right side it will go into the right lymphatic duct. On the left side it will go to the thoracic duct. So that's about the vessels. Now I will go to the I will keep on recording and upload the lectures for your further uh, following, but I will try to continue and go on to discuss the intercostal nerves and the diaphragm also. I think it will take about half an hour more at least. So till now, if you have any question, please do mention, and then we can discuss and move on.